Did it start recording?
Yeah, I started.
What do you think of that as a city? That's not first of all.
Can you hear us, Christine?
All right, so help me a little bit, Lucinda, with who's on Zoom. So I see Christine, okay, I'm seeing it.
Yeah, so those are all.
I got you. All right, we're good.
So we're
Where's
gonna,
Brian?
guess what?
Look, you saved the day, right?
You saved the.
Charmaine's here.
Yeah.
3, 4.
Okay.
I need one more for a quorum, is that correct, Lucinda?
Are you counting the addition of Mr. Fitz?
Hey, Rob.
Are you counting the addition of
I
Mr.
think you
Fitz?
get that information.
Oh, but he's not voting.
Oh, Randy, yeah. Oh, way back. I thought he came.
Okay.
He's from the county, the city manager's office.
Yeah.
And Trevor's from county executive. They're not voting.
Yeah, correct, thank you.
At least you can double check the minutes.
Well, Lucinda's the expert, so she says he's not voting.
Yeah, that's what, but we're glad. So, I need Lucas or somebody from UTS.
Oh, okay, great.
So should I sit over here?
No,
I signed
you're at the
it.
table. You're at the table. You joined a very illustrious table.
Okay.
That's great.
I'm so sorry.
Kendall, are you, I'm hoping you're here as a representative from UTS.
Yeah.
Great. So have a seat, that,
All
you count, you add to our quorum, just trying to figure it out.
I didn't even a name.
Hi, how are you? Good, how are you?
All right, so.
We have a really
Pleasure to
quorum.
meet you. Awesome. Oh, good. Oh, he'll be here next time.
Am I a quorum?
What's up?
Yes, we have
I have
a
quorum. Excellent. With that, I'm going to start the meeting for the Regional Transit Partnership Thursday, August the 24th. And we're declaring that we do have a quorum at this point. So, the first item on our agenda is always introductions. So let's have introductions around the table if we can. And Garland, since I'm looking at you, I'll get you to start.
Garland Williams, Director of Charlottesville Area Transit.
Can I read John?
Morning, John.
I'm still waiting for my gold spot.
John's a rural representative to this organization.
Great.
I'm Kendall Howell from UDA/Parking and Transportation /University Transit Service.
Wow, that's a lot.
Yeah, that's flashes. Let's do it. Good afternoon, Lucas Ames, John Urban.
Thank you, Ed Albemarle County.
Jonathan McKeel, Albemarle County.
Brian Pinkston, Charlottesville City Council. Stephen Hicks, interim deputy city manager for operations.
You're the new guy.
Mr. Sanders is one of them.
Yeah, well, thank you for coming. Welcome.
Glad to be here.
Yeah, we're delighted to have you.
What was he doing?
Thank you.
Peter Thompson with the Center, I represent the Charlottesville area.
Jen Fleischer from the Ridge Health District.
Sandy Shackelford, TJPDC / Charlottesville, Albemarle, and PO.
Lucinda Shannon, the TJPDC, and the staff for this county.
And I'll get Gretchen to introduce herself.
Gretchen Thomas with the TJPDC.
Okay, great. Excellent. So,
Do you want to do the online?
Oh,
yeah. Excuse
all
me.
right, Christine, do you
Oh,
want to?
I do, yes, oh, look, at the Zoom folks, there we go. So,
Christine Jacobs, TJPDC, and then Lucinda, side note, can you promote Ms. Miller from DRPT to a panelist?
Thank you.
And Charmaine,
Yes, Charmaine White with Albemarle, Director of Albemarle County Transportation.
welcome. And let's see, somebody's bouncing around. Sarah?
Hey, everyone, Sarah Pennington, TJPDC, and the rideshare program.
And Katie? She might not quite be there yet. There she
Hi,
is.
Katie Miller. Oh, sorry. Katie Miller with the Department of Rail and Public Transportation.
Great, that's great. Thank you very much. So I think with that, we are good. The agenda today is before you, and before we approve the agenda, just a couple of additions. We are needing to add the April 27th minutes to the agenda, and you have a copy at your table. So we're going to be voting on the April and May minutes. And then I'm going to add, under number 7, item number 7, other business, we're going to be discussing a letter to the Charlottesville Albemarle Community Foundation regarding a mobility management grant. So with those additions, I would entertain a motion to approve the agenda. Ann has made a motion. Brian has given us a second. So if we can have everyone approve the agenda, please say aye. Aye. Any nays, any abstentions? So we have an agenda. And I'm going to give you a minute for the minutes because you do have to be set in front of you. So let me just give you a couple of minutes to take a look at the April 27th, which are the ones that were added. You should have the April 27th. Here. You found it. That's okay. Is everyone not a problem? Everybody has a copy of their place, I think. Yeah. I just want to give you a minute because.
Do we have to, if they're, non-voting, do we have to?
Brian's good. I'm just looking, making sure everybody is good for the minutes. Then I would entertain a motion to approve the meeting minutes from May the 25th and April the 27th of 2023. We have a motion.
Second.
Second from Brian. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? No? Okay.
Supervisor McKeel, Ms. Miller from DRPT is a voting member, and she's online.
Oh, you are correct. I am so sorry, Katie. I forgot that you are there and a voting member. So we need to make a motion to approve you to Zoom. Right, so let's go back to this again. I apologize, that's my fault. And I must say, was used to Neil. And so so let me just say, if you'll unmute yourself, you need to share where you're located and the reason why you're Zooming, which is pretty general, right?
Yes. So I'm located in the DRPT office in Richmond, Virginia, and I needed to be on Zoom because I had to be in the office today in Richmond.
Great. All right, and I very much apologize. So with that, I'd entertain a motion to approve Katie to Zoom.
So moved.
All right, so we have a motion and a second. All those in favor, please say aye. Aye. Any opposed? All right. So Katie, you're now legit. Thank you. I appreciate it, dear. All right. So then we can move on to, we had a motion for the minutes. And I want to make sure for the 2 sets of minutes, and I want to make sure that Katie has an opportunity to vote for that. So can we go back and do that one again? And I'm sorry, but it's a little complicated, but she does think it's a vote. So let me entertain a motion to approve the minutes from May the 25th and April the 27th.
So moved.
Second, okay. Now, all those in favor, please say aye.
Aye.
And I see Katie saying aye, okay. All right, so we've got that. Thank you very much. Matters from the public. Lucinda, do we have anyone? I don't see anyone here, maybe.
Is there anyone here who would like to speak from the public?
And there's no one on Zoom?
And yeah, if anybody on Zoom would like to speak, please either raise your hand or start talking.
So we know you're there, I guess.
Yeah,
I
I don't
anybody's
see
there.
anybody doing that.
Okay, all right. Then we will proceed to our community engagement with transit and health equity. We have two presentations. And Jen, I'm going to turn to you because your presentation is first on the agenda.
Great, thank you.
We're looking forward to it. And this is the Blue Ridge Health District Community Health Improvement Plan.
Right.
And Jen, and then you introduce yourself, Jen.
Okay, sure.
Yeah,
Yeah,
that's great.
Sure.
Yeah,
Okay.
I just wanted to make sure.
Oh, gotcha. And we want to make sure folks on Zoom can see the presentation.
There's the share.
There we go. Charmaine, can you see it, or everybody's not there yet?
Yes,
Okay.
I can.
Great, that's great, thanks.
Thanks.
Nice job.
Okay.
Yeah, that's great.
I don't know, is this like the Zoom part?
Yeah, that's the Zoom part. You know how to do it, Sandy? I think you just right.
Go hide.
Yep.
Yeah.
Yep.
There you go.
Okay. Hi, I'm Jen Fleischer. I am the Child Chip Program Officer at the Blue Ridge Health District. I was formerly your COVID vaccine czar. Now, I don't do that anymore. Again.
Well, and you did an excellent job.
Okay, so it took us a second, but we got it, yeah. Okay, wait, the only problem is, let's see, this is not going, oh, maybe it'll go here now. Let's see. Oh, fantastic. So I'm going to talk about the 2022 Map to Health, which was our Community Health Needs Assessment, which led to what we're working on now with many of you at this meeting, the Community Health Improvement Plan. And I'll go into the Community Health Improvement Plan, the CHIP. I know there's like 6 things named CHIP in Charlottesville, sorry about that. And the transportation objectives in particular. So the 2022 Map to Health is a process that includes UVA Health, Sentara, Martha Jefferson Hospital, and Blue Ridge Health District. The 3 of us are the convening entities that bring together this year 85 agencies, over 135 participants over a 12-month period. We review local, state, and regional data and have work groups on Zoom. With this year, it was quite different. We did it with a leadership and a locality council. The leadership council were legislative folks and elected officials who had any impact on policy. And so we had, for example, Juan Diego attended meetings, and at that time, Sina also did. So we had a lot of folks that had not participated in a Map to Health before. The Map to Health is required for Sentara Martha Jefferson as a nonprofit hospital for their IRS status every 3 years. But for the health district from VDH, we're also required for accreditation to do that. And so we kind of feed 2 birds with one stone and get together and do it together. And UVA participates because there are other major health systems. And once we gathered the 3 of us and all of these folks together for the year, looked at the data, the work groups, and then a photo voice project, which is a qualitative data capture where folks go out and take photos based on the themes that we're exploring. We published the 2022 Map to Health report. So as far as the topics in that report, it came into 4 policy targets: transportation, digital access and skills, healthcare workforce, and mental and behavioral health. In transportation, so most folks at this point are like, I'm sorry, what does transportation have to do with the health district? Now that I know a lot about transportation, no. Now that I know too much to be dangerous about transportation, I can tell you so much depends on transportation. So in the meetings, this topic of transportation and transit in particular really bubbled to the surface. So we have convened at this point Louisa, Green, Nelson, Fluvanna, Albemarle, and Charlottesville as work groups, and we have representatives from that whole 180-mile radius participating, and overwhelmingly, transportation became the leading barrier to health. So not what you eat or how much you exercise, but how you move about in the world. There were 5 main topics that came up as barriers: reliable transportation, inconsistent schedules, lack of walkable routes in rural localities, which you would imagine, transit services in rural localities, and then specifically the Louisa work group, the sheer size and multiple municipalities that Louisa covers were considered a barrier in themselves. The screenshot you're looking at is taken from the report that talked about car ownership, Cat and JAUNT's role in transit, and then kind of, because the map was focused on the social determinants of health, racism as a public health crisis, and health equity, we focused on who is using and what folks are able to access transit and transportation locally. So some of those stats have to do with who rides and who walks and who had access. And I'll take questions sorry, I was meant to tell you this, I'll take questions just at the end of that, but if there's some burning questions, please holler my name and I'll stop. At the end of the map, we came up with recommendations. So nothing in stone, but what we heard repeatedly from all 6 localities, that folks wanted better transit and maybe ride share. Sarah's happy to hear that. But most of that was about bus stop improvements, how to get to and from hospital and medical appointments, expanding the JAUNT footprint, route range is sometimes how it was referred to in those meetings, a shared GPS system to navigate transit, how to advocate for investment in transit and transportation, and to advocate to decision makers from community, funding vouchers for Lyft and Uber for folks to have rides, and expanding the Medicaid transport system contracts. The next steps of a map to health, a community health needs assessment, is a community health improvement plan. So that's where the rubber meets the road, right? How do you make this assessment start to move? So we began the CHIP process in December 22, and then we started to confirm and to organically find, kind of through a light organizational assessment and a kind of look at who having other organizations who are participating refer organizations they work for to form groups, and find conveners to move the needle on some of those recommendations, and then have those conveners really pare down and say, what's possible in 3 years? That's your limit from the IRS to complete some of your improvement plan. We put that in writing, and April 3rd, we launched the plan officially on the Blue Ridge website and other outlets. And from June onward, we published a report, and I update the website at Blue Ridge with progress from all of the 4 policy targets, transportation being one of them, and all of the objectives that they are moving forward. So just kind of by the numbers, we started the transportation conversation January 23rd, and we had our first meeting with many of you who are attending this meeting. We brought in decision makers on transit and kind of leaders in the transit space, and we tried to determine how can we amplify what's in progress, knowing that transit and transportation initiatives take time to activate. And so was there anything that was already going on within CAT, JAUNT, TJPDC that aligned with what the community identified as their recommendations in the map to health? And then what was missing from those, or what could we move on that was missing? And we had a lot of discussion about transit versus transportation, realizing again that we only had 3 years. We really have funneled the CHIP into the transit space. And we've let pedestrian and walking and bike live as a recommendation, but not one that is getting a priority amount of space, only because MCO is dealing with a lot of that in the safety realm, et cetera, and more of the requests focus on transit. So that was one of the first things I learned, that transportation was a bigger word than I knew. So then we have, for transportation alone, we have goals and objectives. So we have 9 of those. And that was at that time after January to now, we've been determining the capacity for folks to convene, to meet, to move the indicators and targets after they've been defined and really be able to get to those goals. And then those goals include 25 tasks. So right now it's a lot of partnership, emailing, everyone in this room is my pen pal. We have a lot of reassessing of when we make progress, where do we need to go from there? If we're lagging in progress, what's causing that barrier? And kind of just working to that end of 2025 goal of, can we improve on these objectives and these goals? So what that looks like is a really gnarly spreadsheet that I gave you a screenshot of that I track regularly on progress based on the target completion dates and those targets. And where we've really landed is better transit, faster service as kind of our tagline. So what's really, how those recommendations have distilled down to the granular tasks are working at improving public transit from multiple angles, many of which Kat and John are already working on. The JAUNT Rural Needs Assessment, which is beginning to be launched. We're trying to decrease ride time from the emergency departments on discharge. So we have a real shortage of drivers, and we have a shortage of contracts for both UVA and Centera, and they had a shortage of systems to track how they're getting folks home. So this one has really bubbled to the surface, hence it getting a bold in the slides, because it's been a real move from the social work department, the transportation department, and the medical departments at the ED to get folks out of the emergency department under 4 hours, which is pretty much what our average is right now at both hospitals, and to kind of really bolster that system. The shared GPS app is also bubbled up from those recommendations. UTS, John, and Kat will be working on that, which is led by Kat as they finish the kind of funding for that project. But I think that'll be that was a great and new initiative from this group that met in January that had a little more legs than I think even the folks recommending it in the map knew, because the 3 agencies were willing to work together, and it makes a lot of sense as a rider to be able to connect, particularly with the microtransit project moving and kind of thinking of collaboration and cooperation. The one that you'll hear soon from Peter that I'm really excited about is community voice in transit decision making. This was also, it came from the map, it was discussed with the group, and it was supported by DRPT in the recent equity report. So this, the Charlottesville Area Alliance is convening and leading that charge, and has recently won a grant from AARP Virginia. You'll hear about that in just a minute, but we're convening again a lot of groups and then riders who will be facilitated with Impact Mobility, another agency, to kind of come to the consensus on what the best mechanism to capture community voice, to have decision-making power will be. And so we're really looking forward to that group and where the advancements they'll make. The microtransit pilot is part of the CHIP, as is the TJPDC mobility program, another one that we're working closely with Lucinda on. And so you can follow the CHIP and the progress at the Blue Ridge Health District website. And that's updated about every 2 weeks. It's not the most beautiful chart you'll ever see, but it is rich, and you might find that you are interested, or the constituents or residents that you work with would have a great voice in contributing to the CHIP, and they can reach out to me to do so, and I can get them involved in any of the work groups, even beyond transit and transportation. Okay, questions and online questions.
Thank you, Jen, very much. I appreciate it. So I'll open it up for questions if anyone might have. Carlin looked like you were going to say something. I'm not reading your body language.
Carlin says, all right, Jen, stop writing me. That's what it is.
And I need to be able to.
Kendall, question.
Yeah, hi. Great work.
Thank you.
Thank you for all the work you're doing.
Thank you.
I just wanted to say that feed 2 birds with 1 stone is chef's kiss. So thank you for teaching me that.
It's a pleasure. Get something out of the CHIP, Kendall. I'm really glad that is it. Victory.
I'm here to break the ice.
Thanks.
Yeah.
So is the CHIP, the sort of, the owner of that, is that BDH or BRDH or
Great question. So
JPDC or?
the CHIP itself is co-owned by UVA, Centera, and Blue Ridge. But Blue Ridge, I am driving the CHIP. I'm the project manager of the CHIP. So all 3 of us track our own entities' participation, and Centera a little more closely than UVA because they have an incentive to do so with IRS tracking. But the three of us meet regularly, review the progress, but I'm really the badger nudging it along.
So this is specifically a health system initiative that includes these aspects about transit, because we need to have better transit to have better health outcomes.
Exactly. You as in Charlottesville have actually participated in a CHIP in some form or fashion for the past 13 years, so every 3 cycles for that. This is the first time we've had a dedicated badger, so it's the first time we're actually making real progress, because 2019 got derailed. All of the efforts from 2019 were derailed by COVID.
And the map to health, how does that relate to this?
It informs the improvement plan, the community health improvement plan. So I think broadly speaking, we usually looked at food security and access to healthcare, and those are embedded into some of the projects of our 4 policy areas. But this was the first time we really looked at policy targets, moving more upstream from the policy level, and really tackling systemic racism and discrimination as a health impact, and then how that spreads out amongst the workforce and transit and serving vulnerable communities to really reduce health equities. The General Assembly, declaration of racism as a public health crisis kind of was the kickoff to the map this year. Does that help, Ryan? Am I correct? Okay.
So I remember probably 10 years ago or so, early generation, and there was focus on lack of available good, healthy food in the food deserts and obesity, and lots and lots of community engagement during that. So this is really fascinating to see. It's been a couple of years since I've sort of heard what's up.
Yeah.
I appreciate all the work you're doing.
Thank you. I'm so glad you're part of that. And just to say, it's not to say that the health district or Centerra or UV are not concerned about food desert. They are.
Oh, no, it's all
I
for sure.
Yeah, I think what happened this year was there's been so much momentum in those areas that they just didn't bubble to the surface in these work groups. And for example, Charlottesville used to be community gardens. They've really taken the lead and have engaged the public so well that it's not an unknown topic. Transit as a topic for health was very unknown, but so acute. So it was really fascinating to get to this, get to health from this direction.
But then you've done the hard work, and then community partners can come in and carry it forward, and you get on to the next thing that needs the startup.
Yes, yeah. So I never knew 3 years was so short until I started something like this. So I have, real appreciation for how long it takes to get stuff moving.
Yeah. The 9 goals and objectives that you mentioned earlier, how are you measuring your success? Are you reaching those?
Yeah, so each goal and each task has an indicator. Percent of folks who ride microtransit. So I worked with JAUNT, and we developed those indicators, and we set a target date for when we'd have that percentage sorted, and that number, or in that instance, the number of riders. And then I'm badgering him for how we're doing. Has microtransit launched? Where are we with that? So it's that kind of back and forth. And then I track it there, and then I put it up on the website.
And did the Centerra, UVA, the group
that
core group, although you're pushing this along, were they the ones who kind of identified that, or was that through some type of input process? Just curious.
Yeah, the input came first from the general work group that started, so that January group that was everybody. We started with, let's really define define the goals and tasks, what was feasible, and who can convene. And that's where kind of CAA and Peter came in, for example. And then as we made smaller work groups to get each task or each objective and then their tasks done, those leads for those tasks would work with me to define them. Then I would report back to Centerra and UVA and say, do you guys know anyone else working on this? Is there anything going on internally that should be added to this? So it's less, and then every Thursday I promote the CHIP on our social channels and our newsletter, and then I do the NBC 29 stuff. And so with partners, I'm constantly kind of marketing it to pull anyone in. It's really hard to get everyone to join, but as far as the indicators go, those got filtered down and then decided by the convener pulling that off. Does that answer that?
Yeah, that
Okay.
was good, so it looks, you're happy so far with the, being the target.
I never want to touch a spreadsheet ever again, but yes, I am so happy with indicators and targets. I mean, you know, I don't think they're realistic. I wanted them to be like, everyone gets a bike in Charlottesville, and we flatten all the roads, and it's flat, and you ride like it's Amsterdam, you know, everyone's like, no, that's not possible. So Jen, what can we do? And so it was great to learn to tie into what was reality, and how that's so aligned to what the public actually wanted. There's still huge gaps. There's still plenty of voices we need to collect, but I feel good about the indicators comparatively to other health districts and other nonprofit hospitals in the state. I feel like ours are very robust, and I have on my team a data analyst who is very, very good at that, and so he's really second that notion to say, okay, these are doable, they're achievable, and they're accurate, and we can go for that.
Would you go back to the page that shows those? And I just want to make sure that folks on Zoom don't have questions. Lucinda, are you able to check through your screen, or just to make sure?
Yeah, if anybody on Zoom who is a member of the Regional Transit Partnership would like to ask a question, you can raise your hand or start talking. Most of them are in the panelists,
Yes.
so.
I just want to make sure because I can't see.
Yeah, I've been monitoring and there have not been any hands raised.
That's great. So just a couple of comments. So when we talk about the micro-transit, obviously you're talking about the grant that Albemarle County is working on.
Yeah, that's
so
right.
that has not started yet, but it's in the works. So you'll be connected for information around that.
Yeah.
And improved public transit is a really broad.
Yeah, so I didn't want to put, there's all those lines, I didn't want to, it got down to, we refined that actually to improve all transit infrastructure. So improved public transit includes bus stops that are designed with mobility and access, and can we work with VDOT and private landowners to get more accessible bus stops? So it's so many things under that, that I just kind of gave it a shorthand, but that's a good point. Yeah, that includes scheduling service, like John's getting a new scheduling service. Can we track how that does, and will that make it easier for riders? It's part of the emergency department piece, it's the bus stops, it's the micro-transit getting folks to places faster and more connected. So it's a pretty robust goal.
Right,
Yeah.
and of course, everybody I think knows that Garland has been working up until now and it is close to some of the shelters you're talking about, and how, you knock on wood, right? And is this real wood? I don't know if this is real wood. And how we might have access to right-of-way in Albemarle County and VDOT roads to put those shelters in place.
Yeah.
So that's a big piece that's been in the works for a while.
Definitely, and we've talked to DRPT about designs. I've looked at the schema for bus stops. Now I know the bus, you have to use a certain metal that comes from a certain place. It's fascinating. I did not get an MPH to learn so much about bus stops, but I now have both beats of knowledge in my brain. So yeah, so it's been, it's just that I think one of my pieces that's really important about the CHIP is this promotion piece. Not only to find out who's missing, who's not at the table, which is crucial to our success, but also the public, to inform them so they can be better advocates for themselves, and so that when they go to council, they ask for a better bus stop, they know what that entails. And so, you know, a lot of it is marketing. I mean, I do a lot of promotion. I mean, it's not as enticing, you know, it's not so fun to do a bus stop thing on TikTok, but it's, you know, definitely part of, you know, I know, sorry. But it's, I can't use TikTok as a government employee, it's true, but it is trying to get, I am trying to get the word out. And that's part of the CHIP, is saying, you know, this is the improvement plan for the whole district.
And just one more quick question.
Yes.
What's gonna be, what's your next step? When will we hear back about the work that you're doing? I mean, what's your follow-up with us gonna be, and the community as well?
Great question. So at any point, you can check out the website and see on-demand progress, but I'll work with Lucinda to do a December potentially or January update, because some of the target dates are end of the year, just based on when grants were awarded, and to see if we can get some microtransit, if the microtransit gets going in the fall, can we track it through December?
Okay,
Yeah,
all right, so we'll
So we'll work on
set
that.
something, in maybe the first of the year or something like that.
that would be great, yeah, that would be a great time for an update.
That would really be great, okay, sounds good. Any other comments or questions?
A few slides back, you had a photo testimony, is that what it's called? Yeah, photo voice.
Photo voice, yes.
Can you tell us a little bit more about that, and will everyone be able to see that?
Photo voice is awesome. So this was hosted by Move to Health Equity, which is a coalition of a lot of health-minded organizations, et cetera. They funded this project. It is a way to, we give disposable cameras to 5 groups of folks and said, look, we're looking at transportation, digital access, healthcare workforce, mental health. Go out and shoot pictures about what that means to you and how that is affecting your life and where you live from all the localities and the city. And then they had work groups to discuss their photos and what they meant. And so it is a formal qualitative data capture, but you can see all of those photos, like the one you're seeing on the screen that's on the cover of the report that's of the Fluviana Health Clinic. That's one of the photo voice photos. So we have that portfolio in the back of the map.
Cool.
And all of the areas that folks, it's almost all barriers, that no one took a photo of like, this is the perfect thing. It was all barriers in there.
Do you want to show them on the website?
Oh.
So it's not,
I'm a Mac person.
Yeah.
it's an app,
Well, she said that you gave out disposable cameras.
Disposable cameras.
Yeah.
but is this your term or is this somewhere else?
No, photo voice is a true data process. Like,
Okay.
yeah, you can, it's like using, instead of using qualitative software, this is a framework for capturing that data.
Conceptually, I really like that for transit services in general. You know what I mean? Yeah.
Yeah, it's great. It's a lot of folks did, they rode the bus or they took John and they took pictures of themselves getting on John, et cetera.
Yeah.
We, it was really great to, you really get firsthand, without convening people constantly or surveying them, they actually get to show you what their life is like and then talk about why they capture that. And it's really fascinating and gives you that firsthand voice and view. Yeah, if you search photo voice, you'll see some interesting
Oh
comments.
man, thank you for the term.
I know, right?
We so often have to make decisions based on anecdotal feedback.
Right.
And just having a picture instead or along with is so meaningful.
Yes, I agree. And this is not National Geographic. You're gonna get some raw photos, it's great. But you can still hear the story. So, yeah, so Lucinda's pulled up the plan on the BRHD website. And there you can see the PDF, the report of the plan. I don't update as much as I do the actual kind of grid, but you can see that we have transportation, and then when you go to transportation, you can look at some of the data we reviewed to get to transportation, some of the partners, and then the spreadsheet of the overall objectives, the details of each task to achieve the objectives, which should then achieve the goals. That big, huge spreadsheet is in the appendix of the report, the PDF itself. Kendall's going to go down that rabbit hole, I can tell. But, you can see, initiate a sustainable mechanism for including community voices in transit decision-making, and Charlottesville Area Alliance is leading that. We're gonna try and finalize that group by September. Here's our target date to have that totally done. We have the indicators, the number of participants in the group, and then the progress is the last column. They got a grant and it was awarded in June. So I keep updating that progress thing.
That's great.
Yeah.
Okay.
Fantastic.
Any other comments or questions?
Very
All
informative.
right, thank you. This is
Thank you.
great.
Thanks.
Thank you.
So now Peter.
So Peter, I think you're on. And Peter is representing the Charlottesville Area Alliance's Transportation Working Group.
CAATWG.
Right.
Here, TJPDC. We all have it.
While she's pulling that up, first, I want to give a shout out to Lucinda. I get to work with a lot of the folks, a little bit less with Sandy and others, but Lucinda's been a rock star for our CAA TWG. She shows up, she does her homework, and really has been a great thought partner for me and the group. So shout out to her, and it's very appropriate that I follow Jen. I'm sitting here envisioning her as a badger. I haven't engaged with badgers a lot in my life, but if that's a badger, I want to make some more friends with badgers because she's really fun to work with. We reconnected after working together in other projects 100 years ago. And when I read the map report that came out last November, I was so thrilled to see on top of C3 and PEC and people looking at transit as an environmental issue, you all looking at it from the standpoint that you're doing as providers. Workforce folks are looking at it to connect jobs and workers and get people to their places of business. Folks who work with low-income housing are working at it from an economic equity standpoint, and then on top of everything else, it's a public health priority. That is a really powerful thing that I hope you all who are putting your careers into it to know that there's a lot of bubbling up here that I think to me gives me some optimism that when the vision comes out and we're actually going out to the public trying to get people to support this more, there's a lot of different folks really interested in improving our transportation from a lot of different angles. When I worked in public TV, you know how you do it. If you do the pitches, if you support public TV, so support us. I've been there about a week. They threw me in front of the camera. I'm standing there on live, and somebody in front of the camera's going,
What is that?
people like, stretch it, we need another minute. I'm like, you didn't give me any training, stretch.
There we go. We're good.
All right.
And I'm assuming that the folks on Zoom can see this.
Yeah, sorry about that.
We're good?
That's what we were
Working on, okay, that's good, thank you.
All right, so when you all elected the Charlottesville Area Alliance as a non-voting member to this group a little less than 2 years ago, I think, I did a little bit of an overview, but I was in the car riding south with my wife, so it's kind of a 2-minute, here's who CAA is. We actually haven't had a chance to really give an overview of why Charlottesville Area Alliance is here and who we are. I know some folks heard a little bit more about it in City Council chamber the other night. This will be a little bit of a repeat, but also some new information. So I'm going to give an overview of who CAA is, which hopefully will help you understand why we're here, and then of course focus on the transportation component. So 1 in 4, what does that data point mean?
25%.
I guess I should be overview of the Charlottesville Area Alliance being an age-friendly group. I'm sorry, Ted, what was the answer? 1 in 4? 25%. Good answer. That's why you're a CEO. In our area, 1 in 4 households have somebody over the age of 65 by about this time. Right. It's not just a small group of folks, it's a growing number. Let's see, anybody here over 50? Maybe a couple of us? Yeah.
I wouldn't dare admit.
Keep going.
So this, I didn't have a chance to update this, and I think that Chris Miller did at the City Council, but this gives you a sense of the growth of the aging population. And this is for the entire planning district, going over 130% basically in a generation. We are on track to do that. It's basically an entire other city of Charlottesville worth of population in our district over the age of 65. And of course, there's a lot of different ways people look at senior. At the center, we talk about 50 plus. These data points are mostly 65 plus. So back almost 10 years ago now, Gary Selmese at WCBR pulled a bunch of folks together who were new at the Alzheimer's and JAVA and JAUNT and a few other places to talk a little bit more about aging in our work. And at first we just kind of met over lunch, and that was perfectly fun. We learned a little bit more about each other and what we were focusing on. People credit me, which would not be unusual for me after a while, 5 or 6 meetings, saying, is there a point other than lunch and a little conversation, get to know each other? And that's when we decided the next time, it's like, is there a point beyond that? Is that good enough, or is there something more to it? And everywhere, Alzheimer's, hospice, JAUNT, JAVA, the center, Ollie, a lot of different folks were at the table. But what we realized was we had one thing in common while we were focused on different parts of an age-friendly community. The Venn diagram was none of us felt that the community was paying attention to aging as an issue. With all due respect to policymakers, grant funders, private philanthropists, community partners. The health department was a little bit at that time. Our health systems were not paying attention to it very well. And so it's like, you know, we need to pull together. And we talked to a lot of other people that formed alliances and created in 2015 the Charlottesville Area Alliance. We are a group of do-gooders. We don't have a budget, we don't have 501c3 status. It's a bunch of people like me and Ted and Lucinda and some other people around the table that get together and talk about age-friendly issues. So you see a list, including many of the folks here. In fact, pretty much everybody around the table is a member. TJPDC, the RHD, the city is, Albemarle County is, JAUNT is. So it's a good representation, not just of the usual folks that you expect, like Java Meals on Wheels in the center, but again, also the Health District, the Planning District, the Chamber of Commerce, United Way, and others. We do have a steering committee of 13 members. There's a core of folks such as the center and Java that are constantly on it, and then we elect at-large folks each year. And then we have work groups that focus on our 3 priorities that I'll talk about here in a minute. Vision and mission, you know, Charlottesville, we love to punch above our weight in Charlottesville, Albemarle, and surroundings. You know, we don't settle for being, you know, good or better, but we want to be the best. So our vision is to be the best, most age-friendly community in the country, and our mission of CAA is to lead the advancement of that work. So age-friendly, when I was a little sharper here, it starts with saying age-friendly is about people, and then you click the extra thing and the dot came up, but obviously I missed that this time. So the joke is already out there. Age-friendly is not about old people. It really is about everybody. The idea is that it is good for everyone. Planning and needing for the needs of an aging population, check off the needs for all ages. One of the most common ones that everybody here will think of is curb cuts. You know, those are friendly for people in walkers and wheelchairs with mobility issues, but if you're pushing a stroller, you're really appreciating curb cuts too. It's something that's friendly for all ages is a prime example. How many folks, some of you I think were at, when Java and the center did an event at the Jefferson School City Center a few years ago, and Matt Thornhill came and talked about age-friendly issues. It was a great group, very thought-provoking, really helped a lot of things move forward. And this is his quote. Matt is out of Richmond, but they do work for Bank of America and some of the biggest insurance companies and organizations all around the world, Home Instead and others. Winning communities in the future will be the ones that invest in creating great places to live, work, learn, and play at every age. The Charlottesville Area Alliance is the right idea at the right time. He did some pro bono work to help us think about whether it was worthwhile to do what we were talking about. So when a bunch of us got together and thinking about this issue and trying to raise awareness of aging and age-friendly issues in our larger Charlottesville community, we looked at a lot of different models out there. And we ended up going with the World Health Organization, partially because WHO is highly respected. They have big reach. They have a lot of research and data behind them. It's not just something that they, you know, write a white paper. They really back it up. So they had actually identified that the aging of our globe was the most important demographic issue we faced around the world as early as 2006. In 2014, AARP joined as the American partner. And the idea is that well-designed, livable communities promote health and sustain economic growth and make for happier, healthier residents, again, of all ages. And we really like the World Health Organization dimension because of the very holistic approach that I'll spell out a little bit here in a moment. Membership, which again, the City of Charlottesville, Albemarle County, and Fluvanna County are members of the Age-Friendly Network. Here, the governing bodies voted to approve that several years ago. CAA, actually Kathy Dimmick, who I think pretty much everyone on the table knows, working for the city at the time, was very active. She actually did most of the writing on behalf of the city and Albemarle at the time, and Fluvanna joined later as well. And membership, and when you are a municipality in the WHO AARP Age-Friendly Network, illustrates that the community's elected leadership has made that commitment to work towards making their community a great place for all ages. Again, Albemarle, Fluvanna, and Charlottesville have all joined through CAA doing some of the work. Quickly, some of the benefits of that. Overall, what we really want people to think of is CAA as a resource. I know particularly you as elected officials have a lot of folks saying, you know, this is the #1 priority, this is the #1 priority. You've got 10,000 #1 priorities, and your stove's only got 4 burners, maybe 8. There's just too much to do. What we're really trying to also help is, again, the city and Albemarle and Savannah have made a commitment to this. We want to be a resource to help you advocate for the types of things that you already want to be able to be doing. So it does give access to a global network around the world, including a couple hundred here in North America, access to information. We get emails regularly and access to symposiums and webinars and conferences that some of our partners go to. Public recognition that you are committed to being an age-friendly community. I know growth's an issue in our community, and not everybody's in favor of it. But for those who do see growth as a good thing, it's certainly better than decline. Being a place that is known to be aiming to be more age-friendly is good for all of us. Speaking engagements, and then the Rural Lab, and Lucinda and Marta made sure I brought that up, because the Rural Lab is a group of municipalities that are more rural in nature or entirely rural, which many around the table are, and certainly a lot of Albemarle County is rural, physically speaking. And you have to be a member of the Age-Friendly Network to have access to the Rural Lab and the work that they're doing and grants that they're doing. So for some of the rural counties that are members of TJPDC, they're not members of CAA yet, we are still more than welcome and encouraging for you to join us and take advantage of the Rural Lab. So there's 8 life elements I mentioned in an age-friendly community. I'm going to go right through these fairly quickly because I want to focus on the transportation component. But CAA did a lot of work in partnership with BRHAD and the university to research, do both quantitative and qualitative studies of out of these 8 dimensions and age-friendly, what do people think we need to be focusing on? Because again, CAA has no budget, no staff. It's a bunch of people like me and Marta and folks around the table who are doing the best we can to have a full-time job and then do this civic work on top of it. So we really wanted to narrow down, and so we ended up narrowing down to 3 of the 8 dimensions, which I'll mention at the end of the 8. So I won't describe all of these in the essence of time, but it won't come as a surprise to any of you because you all do planning and you understand transit is intertwined with housing. And it's intertwined with buildings and outdoor spaces. And certainly the importance of public spaces that are age-friendly, that everybody can have access to is a really critical component, particularly at a time where often what we consider public spaces are actually private spaces. And there is a big difference about what you can do in a private space versus a public space. Housing, I think everybody well knows, is a big priority. Social participation, that's actually our retread softball team that we do in partnership with City Parks and Rec. The Surgeon General did a report here in May that the biggest public health issue at the national level is loneliness. And that's not just for older adults, it's for all ages. And I think there's a growing awareness of that. Respect and social inclusion, which is related, making sure that the generations interact with one another. Civic engagement, a big component of the center, that's a couple of our volunteers at the center of Belvedere. Communication and information, that continues to be a big issue. I'm trying to continue to use technology, but also being aware, as Jen talked briefly about, one of the other areas of CHIP is digital literacy. We're trying to help more older adults and other people for economic reasons who are not accessing the internet. But communication and information is a big component. Then community and health services, no surprise there. And then transportation being the one that we'll focus on now. And one of the summary points that they mention at WHO and ARP is driving should not be the only way to get around. Pedestrians need sidewalks and safe crossable streets. Dedicated bicycle lanes benefit non-drivers and drivers alike. Public transit options can change in scale, can range in scale from rail to ride shares. So when we then dug down and said transportation is one of the issues, and the center is very involved in that because of our strategic planning, and since we built the center in Belvedere, the thing we're increasingly hearing is people can't get there if they don't have a car. Big surprise. Even though it's in the northern urban ring, there's actually fairly good bike and connectivity if you get up to that area. The question is being able to get up to that area. So the center is committed more of my time to this, and Marta asked me to chair the transportation group a couple years ago, and we looked at what some goals would be, because again, there can be a lot of different things. This is before the chip came out. So one was to create a one-call, one-click information nexus for transportation service. So we're really excited that TJPDC is now taking over the mobility manager component, and understand just recently Don's been selected as the vendor for that. We're looking really forward to working together with Java and TJPDC to explore what we can do to be able to get people to either make one click, one call, to figure out all the different alternatives to transit. As we've learned about around this table the last couple of years about having communities do that much better than we're able to do that today. So we're really excited about working on that. And when things get going to promote that service, there are no bus stop improvements again, no big surprise. That was a big priority well before we realized how much CAT was looking at doing that. We are going to advocate for that and continue to, and work with Garland and his team to try to make sure that that happens. And one of the benefits, again, about being part of AARP network is we communicated with our AARP Virginia office, and they are connecting an expert on age friendly design around public shelters to connect with the DRPT as they look at things, because ADA is one level. The ADA, I think many of you know, is kind of 101. There's a lot of things that need to be done to really be age friendly for a wider audience. And so we've connected somebody from our, at no cost to the state to be able to look at that to help create even better designs that CAT and others can take advantage of. And then advocate for transportation in the rural areas. We're happy to have Hal has been a very active member of our work group as well. And again, we look forward to working with the mobility manager on how we can look at rural, not just in rural counties, but again, in the massive amount of rural areas that Albemarle County includes. And then again, I just want to emphasize that CAA sees ourselves as a resource. AARP Virginia has picked CAA 3 years in a row now. They picked one community in Virginia as kind of a focus that they want to invest some of their resources in. And they're excited about some of what's happening in transportation. They're very aware of it, some of what this group and others are doing. And this year they brought, what it is, they bring pro bono technical assistance. And so they've done virtual webinars the last couple of years for us. Many of you attended some of those last year. And I know a lot of folks, including Lucinda, had some really significant takeaways from that. I know the center did as well. So this year we have a group called Impact out of Minnesota that is going to be doing pro bono technical assistance for us. And many of you have been invited to the table. It's one of the things that Jen mentioned, September 21st and 28th. There'll be two-hour sessions virtually with about 15 community leaders, including a couple of transit riders, to look at trying to bring a public voice to the table effectively for public transit. Is that advocacy, not adversary, advisory or advocate role, or is it just a public voice? What are the barriers to doing that? Why do we need to do that? Who has to have that voice? Who needs to hear that voice? Is it the policymakers? Is it the operations folks? Is it all of the above? And we intend out of that, in fact, Jen and I were just working on this in the last 24 hours with our Impact advisor about how to use those 4 hours together, because that's a lot of time that can go by pretty quickly, and making sure we walk out of that out with a full plan, but at least a plan saying how are we going to look at this, who's going to take a lead, what are some of the issues and challenges in that. So.
That was really good, Peter. You got in there.
So we've got a couple of minutes if there's questions.
And I do think that the invites for that have gone out. Didn't I see something?
Yeah, Jen, so CAA got the grant, but because it ended up fitting, and even though it wasn't part of CAA's goals, at about the time, you can see our goals are pretty much moving forward right now. We're kind of there ready to support whatever Garland's trying to do with bus stops and whatever TJPDC and Java are doing around mobility manager. So we kind of, it's like a lot of our goals were on hold, and about that time we got the pro bono assistance again. This idea of community voice came up, and we had a group talking about it. Many of you again were at that, and some of the challenges. It's like, well, maybe we can look at that. So Jen has actually been driving that training as a very nice manager.
And I think the invites are out there, and I think folks can make sure they're in there.
Correct, and many people already accepted it. If we get some no's, then we'll extend it a couple more further.
So let me open it up for questions. Anybody have any questions? Kendall, I'm looking at you.
Kendall brings the energy, man. I love Kendall.
Anybody have any questions for Peter? This was really great, thank you.
Yeah.
Yeah, that's great work.
Yes, it'll come. I didn't get it today. I was going to check afterwards. You know where to find me if you have any questions or comments. Thank you for having us.
Thank you, Peter. perfect timing, it's 5 o'clock, and we'll move on to our transit provider updates.
I respect the agenda's time.
So, Ted, you're first on the list, so I will start with Joan.
Okay, as I mentioned, some of you heard this before, but we launched our microtransit analysis study today. We're very hopeful that we can reduce our costs and also provide a superior service in our service area. We're looking at rural and urban applications for what JAUNT does. Next month, as Jen mentioned, we're going to be launching our rural transit needs study. I think Supervisor McNeil and McKeel and Malik are going to be on that committee. You'll be traveling, so you'll miss the first one.
But I'll get to the second one.
We'll get the second one, and then a lot of other ones too. So we're looking forward to getting that going. We are also going to be launching a bus electric vehicle implementation study, and as part of that, we're partnering with Dominion Energy to install possible fast charging stations in the rural areas. That's great. They can be used for both JAUNT and public opportunities out there. So we're very excited about that. That's it.
That is really interesting to hear. So we'll be hearing more about that, I'm sure.
I'm sure.
Yeah. Okay. Anybody have any questions for Ted?
What stage is that project with Dominion at? Are there locations?
Well, they're filing a grant with the Department of Energy. It's called SYNC, and it's an acronym, and I cannot remember what it means, but it means fast charging stations in rural areas. So if our study succeeds, then what that grant will do is help us fine-tune engineering designs and construction of an actual charging station. So let's say we pick Louisa as a location, and then we would have them have a more fine-tuned location. They would engineer the process and then help build it. The idea is that there may be some low-income areas that could benefit from electric vehicles, but they don't have the capital to buy charging stations. So the idea would be is to have a joint public-private charging station that would be available to JAUNT during certain time, for the rest of the time to private citizens. Our vehicles can't get through a single day on a single charge, so we would have to stop in the middle of the day to recharge it on a driveway break. So that would be very fortuitous for us, but at the same time, the public person could use it as well. So maybe we'll put it at a Walmart or something like that.
That's great. Okay. Anybody, board members, have any questions? They're good? All right. Charmaine, I know, oh, there you are. Would you like to give us your update for Albemarle County Public Schools?
Yes. Hello to everybody, and I'm sure you all have heard in reference to the fact that we had about 1,000 children that we weren't able to transport. So because of the driver shortage, so our efforts is really, our focus this year certainly is recruitment and retention. There are a number of things that we're still working on. Even though we have 1,000 students, we have gotten that number down. It's down to 700 now, and we're continuing to work on it. It is not a way of life for us. That is not what we want. We certainly are trying to get our students to school. And I will like to, I know we're hearing a lot of the negative side of it, but 90% of our students, 90% of the students who requested transportation, we are able to get those children to school on time. So we're really excited about that component of transportation. But again, we're still working to get the other students on board. The other thing that we're focusing in, as we look at recruitment, retention is critical to help aid us in this driver shortage. So there are plans and things that we're doing within the department. We call it our department improvement plans, our work around engagement and the things that we're doing with our staff to engage them more, to hear from them, to hear their feedback. So I'm real excited about the number of things that we're doing internally to engage our employees, to be a part of the solution. So more to come around that. I will say that we have implemented what we call our strategic plans around our route development. Certainly, the focus of our route design was to indeed target students who needed transportation the most. So we do have a SOP in place for that. We implemented guiding principles so we can explain to families how we landed at our decisions around routes. So it's in line with our with the school's strategic plan. So again, I'm really excited about the work we're doing around it. Garland, I will be calling you shortly because what we're looking at is evaluating the number of routes that are open to see how many are actually on the CAT line, what that's already on your route, and see what those options are. I told someone nothing is off the table when it comes to trying to get our students to school. We're going to safely do it. We're going to do it legally. But if there's an opportunity that we can share efforts, I'm not going to hesitate in putting that information on the table with the superintendent and the school board. So more to come. So Garland, I will be giving you a call.
Looking forward to it.
And Charmaine, just quickly, you all have 2 electric buses running right now in the urban ring.
Yes, we
and I think
do.
2 more on order. Is that correct?
Yes, we do. We have 2, and we're having conversations around our plans with moving forward. I know we certainly, in Albemarle, of course, we're a big county. And in order for us to add more electric buses, we got to talk about infrastructure. I know, Ted, you reached out, and I got some folks that are going to be reaching back to you. I know your plans are around Dominion Electric. You want to do some infrastructure work around that and see what efforts we can share. So we will be in touch with you. I got 2 people that I want to reach out to you and be a part of that process and see what our interests, or see what we can do to make or to even improve that. So more to come, and I will be giving you a call.
All right, any questions for Charmaine? There you go.
Hi, Charmaine. It's Kendall from UTS. How are you?
I'm fine. How are you? Who am I talking to?
She's trying to find you.
Okay. All right.
All right. What's your question?
Would you mind if I reached out to you to kind of pick your brain a little bit about your Type A vehicles that you guys are using?
Not at all. Please feel free to give me a call.
Yeah, awesome. Thank you.
Sure. Mm-hmm.
And that's one of the beauties of, I think, this group, is to bring people together and people can share ideas and get connected, and it's really worked well. All right, if there are no more questions for Charmaine, we'll go to Kendall, UTS. You're next.
All right. With me today is Allison Day, our general manager at UTS. I don't want to miss the opportunity to kind of reintroduce Allison. Also, our new director of parking and transportation, his name is Scott Silsdorf, like Wilsdorf salad, but with an S. He started 2 weeks ago yesterday, and the current plan is for him to join us here at next month's meeting.
Okay, great.
I have some questions that I think maybe it's inappropriate to ask in this forum, but I'm going to just do it. For voting member status and all that kind of stuff, how does that shake out? Like, what do we need to do now that Becca's gone?
Well, Becca was a voting member.
Yeah.
So whoever is replacing Becca.
Okay.
Right? And it is a little awkward. The structure of this organization, I will say, with the voting and non-voting is a little different. At some point, we may want to very well revisit all that. But having said that, Becca is listed as a voting member for UTS.
Okay.
So whoever you all decide to send.
So we decide. Okay. All right.
Yeah.
I didn't know if there was like American Gladiators.
Right. Maybe, you know what, the Hunger Games.
Yeah, Hunger Games, yeah. All right. I'm not going to steal Garland's thunder, so I'm going to wait until he goes to mention another thing. So there's a little cliffhanger talking about who's driving. I'll wait for Garland.
Actually, I thought you were going to talk about that.
I can talk about it.
Go ahead.
Okay, so we just had our graduation last week for our Who's Driving program. in conjunction with UVA's pipelines and pathways. We did some community outreach. It's kind of a continuation, if you will, of the Go Driver program. We brought in some folks who interviewed, and we were able to provide, through that program, we were able to provide some workplace training, like essential skills, some English language learning, and then Kat was wonderful enough to host the training. We were able to get them through a good portion of the training to get their CDL permits. And so we currently, UTS has 8 Who's Driving graduates in our training program in-house, and I believe Kat has 3. So this is something that I feel like had some hiccups, as it always will, but it was just a wild success, and we'd love to do it again and maybe expand it out to include, JAUNT, school bus, everyone else. Maybe this is something we can talk about on the RTP level a little bit more.
Sure.
Maybe do a presentation or something.
That'd be great.
To kind of show you guys a little bit more about how.
I see the nodding of heads, so
Yeah.
let's do that. We put it on an agenda.
Yeah. Changing subjects. Our bus lot currently is a construction site, getting our charging infrastructure installed. Our buses are still on schedule to be delivered in December, late November through January is kind of our window. Who we purchased from is Proterra, and you guys may have heard, they just filed for Chapter 11 bankruptcy. We're not worried about it, it's gonna be fine, it's gonna be cool. But we'll keep you guys updated on.
Maybe the price will go down.
That could be. Maybe we'll buy them. What do you think? Anyway, yeah, so they're gonna be sold, and it's gonna be very interesting to see who actually does buy Proterra.
How many have you all ordered, Kendall?
We have 4 on the way,
Okay.
and we've agreed without paying for 2 next fiscal year. So we have currently a 40 bus fleet. We're trying to right size maybe down to 36 with a 12-year replacement cycle. So we're trying to replace our whole fleet with battery electric buses. So it's a little bit unnerving. Right before our first group of buses, like a drive over the horizon and appear. This kind of happens, but we're rolling with it. And let us be the canary in the coal mine, if you will.
Thank you.
We have Vicky Marsh as a member to replace Sally LeBeau, and I don't think that Vicky has ever attended, but she's our main transportation contact at UVA Health.
Okay.
It's an important thing. She's actually retiring in January, we just found out. So we're gonna get another new person, and I'm gonna try really hard to get that second new person to come from Jump Street.
Because we have struggled to get that representation here.
Yeah, I just wanted to give you guys a heads up that is happening.
That's great.
And I really like Ted's leather phone caddy. It's
Yeah,
awesome.
it's pretty cool.
Sorry I talked so long.
No, you're fine, Kendall, it's good. So the CAT report and the City of Charlottesville school report from Garland.
So let's start with this city schools report. No major hiccups with the start of school. We had 14 routes, which was the same number that we had at the end of last year. We have 3 car routes or van routes that are being used right now. We have 6 individuals that were in the background check process. 1 cleared yesterday, and I just got a text message that says another one is on my desk, so I need to see if hopefully they passed the background check also. So they're starting to trickle in. That process has taken longer than we anticipated. It's been about 40 days. Normally it's about a 2 to 3 week process, and we're trying to figure out how to speed that up. So that's a good thing. We also have a partnership that we're working on, a pilot with Network to Work, to also look at getting some additional school bus drivers in the pipeline. They provided us with 6 names. That number has now dropped to 6. We have put those 6 into the background check process. We're hoping and anticipating to get those probably done in the next 2 weeks because they're all went into batch. If all of those pan out, we would have completed our full complement of drivers per our authorized number with schools, which is 20, and we would have 4 or 5 extra if we're allowed to overfill. So that should help us clean up some of that wait list. Remember, this is getting through the process, and then we have to train them.
Right.
And hope that they all make it through the training process. So our training process is 4 to 6 weeks. We've been speeding that up because we are asking them to get their learner's permit prior to starting the training. That has helped. So most of the time we've been able to get it 4 to 5 weeks. That's schools. Transit side.
Quick question while you're still on schools.
Yep.
I believe that I've heard or saw or read somewhere that some of your high school students, maybe it was just high school, I'm not sure, were utilizing CAT to get to school, the CAT system.
So we have high schoolers and we have middle schoolers that have been using last year and they're continuing to do it this year. We've seen that being very successful last year. It's very safe. I mean, there's like 11 cameras on a CAT bus. So we can tell exactly position, anything you want to know, we can figure out what to get. Now, the driver's not responsible for the child because this is public bus. This is not a school bus. So the individuals get on and they're riding with the public, but there has been 0 incidents whatsoever involving the kids going to school.
Great. And I saw Charmaine lean in. I just want to make sure while you're still in schools that somebody doesn't have a question. Charmaine, did you have a question for Garland?
No, I do not. Probably my questions are going to be more specific concerning the routes themselves.
So you can get to him.
Yes, we would have to have one-on-one.
Yeah, I saw you lean in. I just want to make sure. Does anybody else have any questions about schools? All right, then go to your city buses. There you go.
All right, transit side. So a few things on transit. So first, let's start off. We had an alternative fuel feasibility study that we've been working on. There was a presentation to City Council on the 17th of July. Our consultant, Kimberly Horn, and I made a presentation to Council. Thank Ben for all of the background work he's been helping us get done. In that analysis, they did kind of just the legwork of seeing what is out there, all of the possibilities, looking at the ranges, the concerns about that. There was no decision made by City Council. It was presented as a kind of what this is, the lay of the land. Now there's the real work of figuring out, once we have another round of meetings with community groups and internal stakeholders. We're potentially looking at doing some tours if we can to give a perspective of kind of real world what's happening out there and the lay of the land. That hopefully then we'll be in a position, what we say, October, November, late October, early November, hopefully come back to the council with a recommendation. That recommendation will inform the state and the feds on where we are in what fuel type, and then the real work begins with the writing of the transition plan itself. And that's the key document that's needed for us to really pull down any funding to take care of infrastructure. But we gotta keep a keen eye on the reliability aspect, because it does us no good to buy alternative fuel vehicles that are gonna sit if they don't work. So we're a 40 bus company now, because we just got, as part of my report, we just got 5 new 35 footers in, 1 29 footer in. It's taken us 22 months to get those. They're diesel.
Wow.
And 1 VLC that has taken 18 months to get in. We're waiting on 4 more of those. So when we're buying something, it takes a long time, and we got to keep it 12 years, 500,000 miles before we are able to dispose of that item that's FTA rules. So we gotta be very careful, because we have vehicles right now, today, out of our 40 bus fleet, 20 of our buses are down, half. So we are running, still our Lifeline service, we should have been off Lifeline, but we can't, reliability is causing us an issue because we bought hybrid vehicles that weren't ready for prime. So next thing, transit strategic plan is a thing that we have to do. It's a state and federal requirement for us. We're completed chapters 1 and 2. Chapter 1 is kind of the intro stuff. Chapter 2 is more of the
system performance.
There we go. System performance stuff. So we're actually going to be getting into the nuts and bolts of what routing potentially changes that are going to be going in the further chapter, in the future chapters. So it's a really good thing. As a part of our TSP project, we actually did a survey. We had over 500 individual responses. That's a lot for us, for a small transit agency. The number originally was like,
yeah, we had a lot of spam and a lot of bots, and it was
like
closer to
5,000.
It was like 6,000.
Yeah, it was a crazy number. When we looked at the individual IP addresses, it came down to be about 5,000. So that's still a wonderful response. Microtransit, we awarded a contract to a provider, VIA. We're going to be making a presentation to the Board of Supervisors on September the 20th. And bus stop improvements. So Ben was drafted to pull this project together and working with VDRPT, VDOT, and CAT and Albemarle County to make sure that we work through all the issues with VDOT's standards of putting things in their public right of way. That process is going fairly well. We're at the point now where the state has hired an engineering architectural firm to get us site plans. So we have picked sites in the city. Are all of the sites in the county been selected at this time?
I don't think they provided the list yet for the.
So we were looking at potentially 20 in the county and 10 in the city as our first batch. We still have $324,000 available to us to make that happen. That's about 30 bus stops to make the numbers happen. The goal is to get those in as soon as possible. I also have taken the liberty of working with a firm that's actually doing some ADA accessibility for the city. We've added on an addendum, and we're going to do a bus stop accessibility assessment. That's about $17,000 that we're adding on. They should begin Monday. Start adding that on. Hopefully within 30 days we should have preliminary results. But that'll be a great thing because it'll also help us when we're going back and asking for additional funding to improve additional bus stops. So that's my report.
Great. Questions? Any questions? I see a couple hands. Sandy?
Well, yeah, the only question I had is, we're getting a lot of feedback from the long-range transportation plan that's probably more appropriate for you all as part of the transit strategic plan. Do you want me to pass along those comments to you all? Is that useful? Okay.
About bus stops and things like that.
Bus stops and service improvements,
Yeah, sure.
stuff like that, yeah.
So can I pivot up? Bus stop service improvements? We hear a lot about. It's not just up to CAT.
Sure.
Right? So service improvements really mean you're having a conversation with us about what you want, but we have to make that conversation and inroads with city council and board to approve those.
Yeah.
When we lay out our budget, there's no extra.
Sure.
It is designed to fill every single route, and we have a spreadsheet that we provide that tells us how many hours, how many miles we're using on each particular route. If we're gonna make any adjustment to that, you're really pulling service from one to give to the other, unless there's extra money that's gonna be assigned to make those improvements.
Sure.
So that if anybody wants improvements, those conversations need to happen now.
Right.
So we can make a presentation to city council and board about facilitating that, because there is no extra. CAD is not designed that way.
Right, understood, yeah.
But I think the comments would be great to be shared,
Yeah.
eventually shared with us.
Yeah.
Yeah, because I do think, and I know Peter had a question too, but just quickly, my understanding is for the bus stops that you all are looking at, those will come, the ones for Albemarle County, will come back to the board for prioritization, or at least for our input, is what we talked about a couple of years ago.
I'm not sure what process the county planners are using.
Okay, but they're coming to us.
So the county has a,
Those
an
locations,
assignment.
yes,
Yes.
we're good, and I'm happy with that, that's all I wanted to hear.
Two questions on microtransit. One, confirming that both pilot study areas, both Pantops and 29 are going to launch, and any update on best guess and timeline of launch?
Not gonna steal the thunder before we have a conversation with the board, so I would never provide that plan.
Ready to say go.
And that's next month, right, so.
September the 20th. Let's take it,
So
we'll be there.
So after that, we'll have a better idea.
Hopefully, that's the goal. We'll have a better understanding of where we are, and probably, we'll be able to confirm how quickly, they can get the vehicles. They're working on that now.
Because that's again where CAA and our partners are eager to help be part of the marketing, and I've been talking about it a lot around the center, and people are really interested in what that looks like and how they can use it, so looking forward to hearing launch day.
Yeah, we are too, we're
Good try, though.
excited.
Good try.
All right, any other questions for Garland? With that, then we'll go to DRPT. Katie?
I think the biggest one is that, so 2 weeks ago, we had our pre-award workshop presentation. So if you have any questions, or post-award, sorry. So if you have any questions about post-award activities, feel free to reach out to myself or any of the DRPT staff. One of the biggest kind of changes that was announced during that is that this coming grant cycle, so the grants that will be, applications will be opened in December. All new major expansion projects will be required to do a pre-application that will be due by December 1st to be eligible to apply for a major expansion project. So, a good time to start thinking about what applications you might be putting in for the grant cycle opening December 1st. And other than that, just always a reminder, reach out to planning or program staff at DRPT with any questions or concerns. Sorry, I can no longer hear the audio from the meeting very well.
Lucinda's gonna. All right, so unless there are other questions.
I do have a quick question for Katie, if she can hear me.
We'll see if we can get them.
Yep, I'm back on. I can hear it again.
Would workforce development kinds of tasks, studies be eligible for tech assistant grants, or is that totally out of the? If we want to take an innovative approach to hiring drivers and stuff, we want to study the concept, would that be a tech assistant eligible activity? Do you know?
I would say it would be eligible for technical assistance, but might be more applicable under the new expanded workforce development internship grant opportunity. I think might be a great opportunity. I know they're definitely trying to expand that to really focus on the workforce development component of it.
Any other questions for Katie? No? Thank you very much, dear. Can you hear okay now? You're hearing better?
Yep.
Good, that's excellent. All right, it is 5:30, and Sandy, it is time for the Commonwealth Transportation Board Smart Scale Update.
Yeah.
And this is probably more what I was trying to figure out. Right?
Yeah.
When I talked about the monies.
Sure,
the
yeah.
changes are coming.
Yeah, so I'm gonna try, and I apologize because I know there are a few of you in this room who have been hearing about this multiple times, but this is a good opportunity to reinforce your understanding of the changes that are coming. I'm also going to tell you upfront that this has been they probably had 10, 12 hours of meetings on this at the Commonwealth Transportation Board, so I'm doing my best to summarize a lot of really technical information in a very short amount of time. So just as an overview, because I know not everybody has been following this as closely as I am, Smart Scale is the largest funding program that we have to implement major transportation improvements in the state. So basically, we moved to this program about 2017, 2018, somewhere around there, and it's a competitive process where we apply for grant funding to implement transportation improvements. So there are different entities that are eligible to submit applications: PDCs, MPOs, transit agencies, as well as localities. And basically, the applications are scored, and the highest scoring projects are funded. Smart Scale is actually, we talked about the Smart Scale program, is actually two different grant programs. The first is a district grant program. So the state is divided up into different construction districts, and there's funding that is allocated to each of these regional construction districts. That funding is competitive just between the other submitting agencies within those construction districts. And then there's what's called a high priority program, which is competitive statewide. So that's a larger pot of money, and everybody in the state is competing for that funding. The district grant program is intended to fund projects that are locally significant. So these are intended to be smaller projects, and basically if a project meets a need that is identified in the state's transportation plan called VTrans, it is eligible for funding through the district grant program, but only localities are the eligible applicants through the district grant program. In the high priority program, there's more funding, it's competitive statewide. This is intended to fund projects that are of regional or statewide significance, so intended to be bigger projects. And so in addition localities, that's where MPOs, PDCs, and transit agencies are also eligible applicants. To be eligible for this program, the project must meet a need that is identified on a corridor of statewide significance. So in our region, that is 29 or the 250/64. Corridors, or regional network. That's based, this is defined in the statewide transportation plan, the regional networks, but it's mostly based on the MPO areas. So there are two different programs that will come up again in a minute. The other background information that will be helpful to understand some of these other changes is that there are different scoring factors. So remember, projects are scored. These are the scoring factors that are scored on: safety, congestion, accessibility, land use, economic development, and environmental impacts. So those are the different benefits that are calculated when you're determining what the benefits of a project are compared to cost. And then the state is divided up into different area types. And so what happens is that the weighting of each of those scoring categories is different depending on which area type you're in. So the MPO area, which consists of the City of Charlottesville and the urbanized portions of Albemarle County, is in this purple section right here. So that's area type B. It's a more urban area. So what you'll see is that in the more urban areas, there is a higher percentage of points that are given to things like the accessibility, improving accessibility, and congestion relative to the more rural areas. Anything in our region outside of the MPO area is an area type C, so a little bit more rural. And so this is going to get a higher percentage of its points from safety specifically. Okay, so what has happened is that in February, the secretary charged the Office of Intermodal Planning and Investment staff, who is the staff that oversees the Smart Scale program, to basically do a comprehensive review of the Smart Scale program and determine if it was meeting its state objectives. And so they've done this analysis, and these are some of the outcomes that they've identified. And so they are coming back and saying, based on our assessment of how the Smart Scale program is operating and looking back at what our stated purpose and objective and goals were for the Smart Scale program, there were some areas that they had highlighted that might be might be a cost for them to want to review whether or not they want to make some changes. And so based on this analysis, the staff has developed a series of recommendations that the Commonwealth Transportation Board is considering. So I'm going to go through those very, very, very briefly. This is an ongoing conversation, so the CTB is not finished maybe having this discussion yet. These are all under consideration right now, but they are not implemented right now. There will be, the conversation will continue again in September, and all of the recommendations will be finalized for feedback in October. All right, so the first kind of concern that was brought up is that the overall size of the Smart Scale program has increased in size by 50% since it was originally put into place, but the capacity of the staff at VDOT has not increased accordingly. So what's happening is that the same staff that are responsible for supporting the development of applications are also responsible for scoring the applications and are also responsible for actually doing the project delivery, so actually implementing the projects that are funded. So what's happened is that as the size of the program has grown and the number of applications has increased, there's starting to be a backlog that trickles down from just like the development of the applications to the actual delivery of the projects. And so they did some analysis, found out that there's a lot of time being spent on applications that are not being successfully funded. So, one of the recommendations that the OIB staff has made to the Commonwealth Transportation Board is to reduce the number of applications that each submitting entity would be eligible to submit. So they're reducing it. Currently, we're able to submit 4 applications. For our size area, they're recommending that we would reduce it to 2 applications. And then there's some other recommendations related to just making sure that, at the application deadline, that all of the required attachments, cost estimates, supporting documentation, et cetera, all are in place at the time of the application. That isn't likely to impact our area significantly. And then there's also been a discussion about for localities that administer their own projects, so that's the locality staff, not VDOT staff, is actually implementing the construction projects and managing the project. There are concerns about project delivery in some cases, so there's also this discussion about factoring in performance and project delivery for locally administered projects when developing final recommendations for funding.
So help me, quick question, so does that mean Charlottesville versus Albemarle? I'm just trying to figure this out. So I thought Charlottesville, implemented a lot of their own projects.
Correct.
We do not, we use
Correct.
So that's the difference. I'm
Yes.
just trying to figure out what we're talking about.
Yeah, so basically, for if the city of Charlotte, I'm not picking on the city of Charlottesville, but they
I just wanted to understand it.
Yeah, but they administer their own projects, so they would look at project delivery when they were making decisions about final outcomes for funding.
So when it says project delivery, that's
Yes.
that's what they're talking about.
The constructing the
Because we
project.
have the 2 examples.
Yes.
Yeah.
Yep.
And Sandy, perhaps one other element too is that even in the county where we're not administering the project, if there's tremendous discord in the community, they're not
About a project.
They're not going to
Yeah.
pay for it. So
Yeah, that makes
we do
sense.
have to get on the program.
Yeah.
If we're going to have a program.
Yeah.
Yep.
And that makes sense too.
So that's kind of related to the administrative part. And for these next sets, there's a whole analysis, and I'm not going to go through the complete background of why all of these recommendations are going in place. I just want to give you a preview, but if you want more information, I am happy to provide that. I have a number of resources that are already developed. The second issue that we haven't really talked about in length at any of the meetings is for our region, I'm not sure that this is going to be a significant impact, is that there's also, they got a lot of feedback when they did a stakeholder survey requesting that they use a future growth projection when they were basically assessing the benefits of based on the congestion mitigation. And the reason is because it takes 5-6 years to implement a project. So basically, the argument is that we are basing the congestion score on the current conditions, but by the time the project is implemented, there are going to be future congestion conditions if we want to be proactive about thinking through what is going to have the biggest congestion benefit, we should be looking outward 10 years. I don't have a good sense of how this would impact our region, but, and they're going to come back and talk about this more in September, but one of the things that I also want to note is that if they are changing this benefit score for the congestion factor, they've indicated that it would also have sort of like a trickle-down impact on how they evaluate economic development, accessibility, and environmental measures as well. Any questions on that one? All right, so this is great. Remember when we first talked about this, there are 2 grant programs, district grant program, high priority program. So they spent a lot of time in the Commonwealth Transportation Board meetings talking about what types of projects specifically are being funded through the high priority program. And one of the concerns is that between rounds 1, 2, and 3, and then going into rounds 4 and 5, a higher percentage of the projects that were funded through the high priority program have been under $10 million, or what they consider small projects. And specifically, there's a concern about the number of high priority program projects that are small, that are being funded, that are bicycle and pedestrian projects. And so the concern, or the discussion that they're having, is that the high priority program is really intended to be to fund projects that are going to have really significant and meaningful impacts on these corridors of statewide significance or regional networks. And so it doesn't seem to fit that that the number of small projects that are being funded through the high priority program has tripled between rounds 3 and 4. So what they discussed at the Commonwealth Transportation Board is that right now, the eligibility to receive funding through the high priority program is based on where a project is located, either on the corridor of statewide significance or the regional network, but there's nothing that really defines what types of projects are eligible for the high priority program. So they are considering limiting the types of projects that would be eligible to receive funding through the high priority program to those that are listed here. New capacity highway, managed lanes, which would be like an HOT or HOV lane, new or improved interchanges, new or improved passenger rail stations or service, freight rail improvements, fixed guideway transit. And the only thing I really want to point out here is that this would limit the MPO, PDC, and transit agency, who are only eligible to submit applications to the high priority program, to only being able to apply for those types of projects. So I did look back through all the projects that have been submitted in our region. So I looked at the projects that were submitted by the MPO, by the PDC, by Charlottesville and Albemarle. I did not look at the rural localities because I do not believe that we would have been eligible to submit any of those projects at this point. But these are the projects. So out of rounds 1 through 5, these were the projects in our area over the last 5 rounds of Smart Scale that would have potentially met that requirement based on that new definition.
That would have.
That would have. So there's 6 projects I know for sure would have met this, and an additional 2 that maybe would have met this definition. And just as a comparison, not counting the locality submitted projects, the MPO and the PDC submitted a total of 28 project applications. And the MPO was the applicant for all of those projects. So out of 28 project applications, 6 and maybe 8 would have met this criteria. I will say that the MPO was the applicant for these, so at least in terms of the MPO, being the applicant for these regionally significant or projects that are of statewide significance, we've aligned that pretty well with who was submitting the applications in our region. Okay, and this is a little bit complicated, but the next change that they're talking about making is a change to how the high priority program funding is awarded. And I'm going to walk through an example in a minute because I think that this is going to make way more sense. going through it. But basically, the first step in the process is you group all the projects by the construction district that the application comes from, regardless of whether it's only eligible for high priority program funding or district grant program funding. All of the projects are grouped together by their construction district. The first step is to take all the projects that are eligible for the district grant program funding and prioritize those projects within the construction district. The next step is a little bit confusing. I'm going to walk through an example, but you allocate the high priority program funding on a district-wide basis. Explain how that works. And then that's how you get to the third step, that is actually a competitive statewide process. So we're just going to look at a hypothetical construction district with made-up projects. So the first thing that happens is we put all the projects into their construction districts. We're going to look first just at the district grant program, and we're going to say, you know what, our district grant receives a certain amount of money. The projects that scored best are going to be funded, and the lowest scoring project that is funded is this West Lane shared use path. This West Lane shared use path, which is the lowest scoring funded project through the district grant program, sets the threshold under the current funding steps, sets the threshold for how well a high priority program must score in that construction district in order to receive funding. So currently, if a high priority program it scores better than the lowest scoring district grant program, so in this case it's a 6.4, and the total amount of that project is less than the total amount of the project, of the amount of funding in the district grant program, that project is funded in step 2. So in this case, West Lane Shared Use Path sets the threshold for a high priority program to receive funding. And in this case, this interchange improvement project would receive would be awarded funding through the high priority program under the step 2. That's super straightforward, right? Yeah, so what happens is that if you are in a district where the lowest scoring funded district grant program is 6.4, there might be another district where the lowest scoring district grant program funded is like 2.7. And so that high priority program funding is going to be dependent on how well your district grant program scores perform. So what's happening is that there might be higher scoring projects in different districts that aren't being funded, even though they're relatively scoring better because they're in a different, more competitive construction district. So the recommendation is to eliminate that step 2.
And the cost of construction in that district is a big part of how this cost-benefit ratio is scoring. So if you're living or your application is in a much less expensive area, then you're perhaps going to do a lot better.
Yeah, especially right-of-way, with the right-of-way compensation requirements, things like that, yeah. So this doesn't seem to necessarily, seem like it would impact our region significantly, but if you're in a region that scores generally lower, what this means is that you're less likely to have a guarantee that you'll get some of your high priority program projects funded. Okay.
I'm watching the time, Sandy.
Yeah, I'm trying to move very quickly.
You're doing a wonderful job. I just am watching my time because I'm the official time.
Yeah. We got I think 2 more. All right, so the next change is related to the land use scoring factor. And so there's a lot of analysis that was done with this. But the major concern is that there are projects that are receiving a land use scoring benefit or land use score that is significantly higher than the amount of benefit that they're receiving in other scores. And so there's this concern that projects that are smaller and specifically bike ped projects might get a majority or like 90%, 80%, 70% of their score from the land use score and not be demonstrating significant benefits in other scoring criteria. And so that land use factor is driving the selection of projects. So what they are recommending is that they convert the land use scoring factor from a standalone score. So instead of getting a land use score, you'll still get your land use benefit calculated, but instead of that being a score, that would be converted to a multiplier. And so that multiplier would be multiplied against the total number of points that you're getting in all of the other scoring criteria. So if your project is the project that has the highest land use score for for that round of smart scale, your total sum of your scores and all the other scoring criteria will double. And everybody else will get a multiplier somewhere between 1 and 2 based on what their land use benefits are compared to the one that scored the best. So this will largely impact projects that are smaller in nature, and also will heavily impact bicycle and pedestrian projects that are typically getting a large percentage of their points from the land use factor. So I did a quick analysis to see how this would change the scoring outcomes. You'll see the biggest impacts are to the Avon Street multimodal project, pedestrian improvements, and bike ped projects. And then if I run this scenario with the changes to the land use score, the outcome is that the only project that looks like it would have been funded in the NPO region during this last round would be this US 250 Peter Jefferson Parkway. We wouldn't have gotten other projects funded. Yeah, I do recall that project was later substituted out for the District Avenue roundabout, but that would have been the only project that would have been recommended for funding. And then because that land use score is no longer a standalone score, what happens is that we would have to reallocate those points that were going to land use before. And so the recommendation for type B would be to add, that was getting 15% of their points from land use. And for the type B localities, they would add 5% to safety and 10% to congestion. And then for type C, it would be, that was getting 10% of their score from land use, 5% would go to safety and 5% to congestion. So this is the sort of what the outcomes would have been statewide if all of these recommendations were implemented. The size of the projects on average would have increased, I think that's about, I don't know, I calculated that at 40%, that might be right. From 15 million to almost 22 million. It would increase the number of highway projects by 1, and the most significant impacts would be on the number of bike ped projects would be funded. That would have been reduced from 51 to 13. So, yeah, that's the very highest level summary, but, and I know I still went over time a little bit, but I think just know that there are opportunities to comment. This is an ongoing conversation, so if you have any questions, I'll be happy to.
And all of us are going to hear this again a couple of times.
Yeah,
so
hopefully it'll be a little more.
Just because of time.
Yeah.
Unless there are really any questions.
Sure.
We could move on if that's all right with folks. It is very complicated.
It is.
And the more often we hear it, the better. Quickly, because of time, Sandy, MPO Long Range Transportation update, is there anything critical?
No, I put out the postcards. If you haven't taken the survey yet, please take the survey. It's running through August 31st.
Great. Transportation Implementation Plan, the TIP update, anything critical?
The only thing I wanted to say about that is that the policy board last night approved an amendment to add $10 million in CMAQ funding to support passenger rail service from Roanoke that would go through the Charlottesville region.
That's excellent. Yes, we like that.
We're all set.
That was worth hearing. That's great. And quickly then, because I really do need to get to this CACF letter that we need to talk about. But Lucinda, do we have regional transit governance study? Anything that we need to really hear right now?
I can save it for the next meeting.
Well, I do have a question.
If there's a question, that's
Yeah,
right.
it'll be really quick.
Sure, yeah.
I saw you had different scenarios for revenue generation, sales tax,
Yeah.
this kind of tax, or whatever. Was a utility tax considered as a possible source?
No.
That's probably as we move to electric vehicles, that might be better than a gas tax.
Yeah.
Good thought.
And I know there's one transit system that uses utility that I'm aware of. That's in Springfield, Missouri.
Interesting thought.
And Broadway, Virginia is one of their major funding sources
Oh,
for
it
local
is.
government.
Okay.
They say nothing about transit.
Yeah, interesting. Good catch. I mean, good thought. Thank you.
Yeah, I'll see about that.
So that leaves us about 8 minutes because we really do this is time sensitive, Lucinda. My understanding is, so if everybody can, you have a copy of the letter at your place. that, and this letter is to Charlottesville Area Community Foundation. Lucinda, I'll let you explain it, because people have a copy in front of them.
All right, so the mobility management program, you all probably know, we were funded through DRPT. Our original budget for the full cost of the program was $158,000. We were awarded $119,000, 370. We did reduce our ask for DRPT to $129,000, but so we have about a $30,000 gap in funding for the project. So we're looking towards other funds for this, because what that did was reduce the hours that staff has to work on the program. And so we're applying to the Community Foundation for a Bomba Works grant for, I don't remember how much, but it's like, I think, 8,181 or something.
It's under 10,000.
Yeah, it's under 10,000. I'm asking the RTP to sign a letter of support for our application for that program.
And the deadline is August the
It's, September 1st.
I said August, I'm sorry, September.
September.
So that's why I'm trying to get to
Yeah.
this tonight before we leave, if we could, the date on here says January 24th, is there some reason for that?
Oh, no, that's a mistake, I'm so sorry.
Okay, so, has anybody else had a chance
Just
to
do it,
look at
that's
it
all.
quickly and see if there are any other edits? I'm looking to Brian, because he's really good at that too. But,
Looks fantastic.
yeah, there you go. So we'll change the date, and, are there any objections, any comments, any thoughts? I would entertain this, I would think this needs to be voted on, so I would entertain a motion from someone.
Yeah, I move that we endorse this letter requesting support from the Bama grant to support the implementation of the mobility management program.
As amended with the date.
As amended with the date.
There you go. And second from Ann. So all those in favor, please say aye.
Aye.
Any opposed? Any abstentions? So, yes. Thank you very much for allowing us to get this done. And I don't have any other business. Does anybody else have any business that they want to bring forward or mention? Okay, then hearing no objections, I will adjourn us to September 28th, same place, same time. All right, thanks guys, we did it. Great.
Have a good one.
Well, it's not a grant.